everybody. I am Professor Antonio Ceriello, and I'm speaking from the ESD Congress. I am engaged with the ESD in several activities, but I think that the most interesting are that I'm the chairman of a diabetes and the CVD study group, which is a reference group of the ESD for cardiovascular disease in diabetes, but also member of the CCA board, which is the ESD board evaluating all the guidelines or position statements which needs to be endorsed by the ESD. So this Congress, as usual, has been very, very interesting. And there are some topics which are very hot and of great interest. First of all, we have news about the problem of diabetes distress. There was a specific session on this topic here at the ESD, but also I can announce that the ESD will be engaged in specific guidelines developed in cooperation with several other societies in order to afford this complex and emerging let's say, comorbidity which is present in so many people living with diabetes, which of course we know is not an easy disease to live daily. Another very interesting information came just this morning from the presentation of the CVOT trial regarding tirzepatide. You remember that in this trial, tirzepatide has been evaluated against dulaglutide. So it's the first trial made in comparison with an active drug, new drug versus an active drug. The results were quite interesting. First of all, there was a non-inferiority of the tirzepatide, which in practice means that tirzepatide is good as well the dulaglutide preventing cardiovascular disease, but also there was a superiority for total mortality regarding tirzepatide use. This is also a new intriguing news, which probably deserve more detailed study, because this is emerging as a new property of the class of the new let's say GLP-1 or GLP-1 made in combination with other hormones. And also, finally, we can also speak about the possibility that cardiorenal-metabolic disease is something very important to address. Many presentations or symposiums were dedicated to this new concept, clearly demonstrating that kidney and heart are strictly linked. And usually, when you are able to diagnose one problem, the other one is following already present. So this is suggesting that the new approach to consider cardiorenal disease as unique complex complications of diabetes is real and needs to be faced at the same time in both sides. And we are lucky because we have new drugs and new evidence performing a good outcome in preventing these complications. So, thank you for your attention. Goodbye.